I am Nadine Carty-Keynes, and thank you for joining us at the Nevis Emergency Operations Center briefing in regards to the novel coronavirus, COVID-19, here on Nevis. This briefing provides an opportunity to update the population on Nevis in regards to what's happening here and our response. I want to take the opportunity to thank all the media houses and for all our viewers who are joining us. All questions will be taken at the end of the presentations, and the Nevis briefings are aired on Mondays and Thursdays at 8 p.m. on Nevis Television. Today we have with us Mr. Brian Dyer, who is the Director of the Nevis Operations Center, EOC, and also co-chair of the Nevis COVID-19 Task Force. We have Dr. Judy Nisbet, who is the chair of the Nevis COVID-19 Task Force. Mr. Lyndon David, who is the Superintendent of Police, Nevis Division, and also a member of the Nevis COVID-19 Task Force. Ms. Sandra Maynard, who is the Director of Social Services. Ms. Curtis Clark, who is the psychosocial focal point for St. Kitts Nevis Red Cross, Nevis Branch. Mr. Huey Sargent, Permanent Secretary in the Ministry of Agriculture et al., and also a Nevis COVID-19 Task Force member. And Ms. Zanella Claxton, Principal Education Officer, Department of Education, and who is also a Nevis COVID-19 Task Force member. I'll now give over to Mr. Brian Dyer, who will provide the updates on behalf of the EOC.
All right, good evening all. The Nevis Disaster Management Department continues to operate 24 hours, and I'd like to give a special shout out to the disaster management staff who is holding down the fort, along with the Ministry of Health and the Royal St. Christopher and Nevis Police Force. The new regulations of the SRNO 14 of 20 was released on the 18th, and it specifically guides the operations and governs the relaxed curfews or actions during relaxed curfews. Chapter 15 specifically speaks to the mandatory wearing of masks in the public. And from my visits to the communities and in town today, I saw some persons still without masks. Just want to reiterate that the SRNO 14 or 20 says it's mandatory to wear a mask in the general public. So those persons who are guilty of breaching that rule, please ensure that you get a mask as soon as practicable. The SRNO also has seen a reopening of most businesses, and however, with some restrictions. Some of the restrictions are with regards to spacing and hygiene, practicing washing of hands, etc. With this, I've received some phone calls with regards to the standard of the standards of the hand sanitizers being used across the business entities. So in that regard, the St. Kitts Bureau of Standards was contacted, and they are in the process of identifying and coming up with a standard for the hand sanitizer that should be used in the Federation. Right? The disaster management also continues to monitor the other hazards, not only COVID-19. We are in a drought period, and the drought would get progressively worse as we enter into the hurricane season. So in light of the hand washing or hygiene protocols being expressed by the Ministry of Health, I still want to ensure that persons conserve as much water as possible as we go into the hurricane season and further into our drought period. With regards to the hurricane season, it's fast approaching, and the University of Colorado, Dr. Philip Klobatz, has released his report, and he is predicting 16 named storms for this hurricane season, 8 of which could be hurricanes, and of the 8, 4 could be major hurricanes with winds of 110 miles per hour or greater. So it is behoving of us that we should start our preparations with regards to our hurricane season. The Nevis Disaster Management Department will be publishing the list of shelters to be used during the 2020 hurricane season. And bearing in mind we are still battling the COVID-19, the spacing would be looked at with regards to the capacity issue at the emergency shelters. Preparations are also being made at 6 of our shelters to ensure that we would install generators as the weeks progress into the hurricane season. And finally, I would like to say a special thanks to Mr. Rene Busu and his team of friends who have catered for the emergency services and the essential workers today for lunches. And they'll be back again on Thursday this week to providing more lunches for the essential staff and emergency services. I'd like to say a special thank you also to Double Deuce Restaurant, who will be providing lunches to the emergency services tomorrow, Tuesday. Thank you very much.
Thank you, Mr. Dyer, for those updates, and we want to say thank you to all those persons who continue to contribute, who have contributed and will contribute in the future. And thanks for the update in regards to the hurricane season, as we have to keep that in mind. June is fast approaching. We now have our presentation by Dr. Judy Nisbet, who is the chair of the Nevis COVID-19 Task Force.
Good afternoon, all. I'll start with the statistics for today. To date, on Nevis, we have tested 77 persons. 60 results are reported as negative, 4 results are positive, and 13 results are pending. In quarantine, we have 45 persons, and 160 persons have been released so far from quarantine. All persons testing positive continue to be without symptoms and are doing well. Persons are required to remain in isolation, and during their recovery, we follow them daily. Once they no longer report symptoms, we then follow them for a further 14, sometimes up to 21, 28 days, depends. After which we perform 2 tests at least 24 hours apart. And if both tests come back negative, then we can say that these persons have recovered from COVID-19. Now, as Mr. Dyer would have said, there has been some relaxation of curfew measures. I want to encourage persons to practice this physical distancing of 6 feet, the hygiene measures to prevent infection and to break transmission of the SARS-CoV-2 virus. Persons need to be disciplined. I encourage persons to be disciplined and adhere to the measures that we outline over and over. Measures such as washing your hands throughout the day. If there's no soap and water available, we encourage persons to use a hand sanitizer, alcohol-based hand sanitizer. Sneeze or cough into a tissue and throw it away, and then wash your hands. And throw that tissue, not just throw it away, throw it into a bin, preferably a closed bin. If you do not have a tissue, cough into your elbow. Wash your hands. Clean commonly touched surfaces throughout the day. We encourage you to stay 6 feet away from others, and we encourage the wearing of a mask in public places. We continue, as you do this, we in health, we continue to do case finding by carrying out testing. We continue to quarantine and isolate persons as necessary, and to perform contact tracing, all this in an effort to contain the disease. So in other words, please do your part as we do our part within health. I want also to remind persons that they should not ignore their health conditions. There are many persons with chronic illnesses, such as hypertension, diabetes, cancers, kidney disease, etc. Please don't ignore your chronic diseases because we have such a great focus now on COVID-19. Continue to take care of your health needs, take medication as prescribed, exercise, eat the right foods that you have been advised to eat. If you have a health condition or a health concern at any time, contact your physician. You can visit your health center or hospital as necessary. We want you to pay attention to COVID, but not to forget other aspects of your health. I encourage persons with chronic diseases because, as we are aware, persons with chronic diseases are at greater risk of the complications of COVID-19. That is, getting more severe disease. So please pay attention to your chronic illnesses. I want to remind persons that the health centers are open. We continue our immunization program to avoid any outbreak of vaccine-preventable diseases. We can't ignore other aspects of health, even though we are concentrating on COVID-19. We continue to immunize infants and toddlers. We continue to do daily dressings and district medical officers' clinics on the partial curfew days. For most clinics, we are attempting to schedule patients, especially the larger clinics that have a lot more persons coming, and all that is in an effort to prevent crowding. So please, remember you're reminded that the health centers are open for business, and please continue to take care of your health. Thank you.
Thank you, Dr. Nesbitt, for that update and for the reminder to persons with other health conditions that they need to continue to pay attention to it, and even more so, adhere to the instructions by their doctor or healthcare provider. We'll now have Mr. Lyndon David, who is the Superintendent of Police, make his presentation.
Thank you very much. Good day to all. It's a pleasure to be back here again to give you some information regarding the work of the Royal St. Christopher Nevis Police Force, Nevis Division, and to let persons know that based on the new regulation, SRN 014, Emergency Powers COVID-19 number 5, we have some new instructions and restrictions to deal with. Firstly, I will start with some stats in order to let you know what we've been doing thus far. So far, we have conducted about 344 patrols, 26 vehicular checkpoints, 9 arrests for curfew breaches, and 3 persons were charged for those breaches. Persons are still out there intending to break the law and cause other persons to be victims of crime. So during the period, we have had 4, we made 3 arrests, and we had 3 persons who were charged for those offenses. Persons are still moving about, breaching the curfew in their vehicles, and we have stopped during the VCPs and those breaches. We have 516 vehicles were stopped, and a number of persons were warned, and some persons would have presented their necessary permissions to be on the road during that period because they were essential persons moving about. 8 persons were informed that they would be summoned, and in short order, we may have court action be taking place. This week we will be having 4 days of limited operation. And this all to do with social distancing and physical distancing and hygiene. That was explained earlier by Dr. Nesbitt, so I will not go into them, but we are just encouraging you. Practice social distancing and proper hygiene. Remember, it starts at home. It starts with you in order to protect your family, yourself, and the rest of the country. Under the new regulations, businesses can open provided that they can ensure social distancing and hygiene. We expect businesses to have the necessary demarcation, someone outside ensuring persons are wearing the mask If you're in the line and you do not have a mask, we expect the security official there, a rep from the establishment, ask that person to leave. If the police come and see you there, we will tell you to leave. If you fail to leave, we will arrest you. You can be summoned or you can be warned. I prefer you go there with the mask on to avoid the contamination. Some restrictions. I'm still receiving calls about attending beaches. I will say to you, no. Even if you say it's for relieving of pain or for some reason, do not go to the beach. We see you there, you'll be summoned or you'll be asked to leave immediately. Bars and rum shops. We're still hearing and still seeing persons are opening retail liquor license premises. The new regulations still continue to say that these premises must be closed. So the act pertaining to liquor license premises has been suspended, therefore none of these places should be opened. Regulations 8 deals with public service vehicles. And I will just read briefly to what it says. Notwithstanding Regulation 12, during a day of limited operation, no person shall offer for hire or seek to travel on any motor omnibus, any hiring car or taxi or any passenger ferry, unless there is not more than 2 passengers per row of seating. B, all persons wear a mask at all times pursuant to Regulation 15. C, windows remain open or partially open depending on the weather conditions. So therefore, if the sun is blazing, take off the AC and ensure that the windows are open so fresh air can come in. If rain is falling, obviously we expect you to use the AC. All persons shall practice good hand hygiene, proper sanitary behavior, and social distancing. So before you enter the vehicle, we expect the owner or the driver or conductor, whichever the case may be, apply some form of sanitation to your hands before you go into the public service vehicle. We're going to touch on Regulation 9. We have some calls about farmers, fishers. It says during the day of limited operation, works on construction, we have farmers, fishers may operate, but you must provide social distancing and hygiene. Persons are trying to move about without urgent matters. If you have to get somebody to cook for you during the time of 24 curfew, get your supplies and deal with your meals there. Do not ask to go to someone else. Deal with it there. I take this opportunity to thank God for continuing to bless in our federation, wherein we can see no new cases coming as we see in other countries and deaths. We also want to thank him as well for having us to be here to bring information to you that are important. I thank all of my staff who are supporting me, medical personnel and all the other frontline persons in this regard, and the media as well to ensure that we disseminate this information to you. Thank you very much and do enjoy the rest of the evening.
Thank you, Superintendent David, for your updates and for going through some of the regulations that are in place on these partial curfew days ahead. And just remember to always practice your social distancing and to wear your mask when you're out and about, along with all the other measures that were stated by Dr. Nisbet, Mr. Dyer, and now Superintendent David. I'd like to now invite Ms. Sandra Maynard, who is the Director of Social Services here on Nevis, to provide some updates.
All right, good day everyone. As a reminder, the social services number for requests for assistance and general queries is 665-2501. That is important because people have been showing up at the department in numbers more than what we are comfortable with. So if you're not coming for an emergency, like a child protection, child abuse matter, we're suggesting that you still continue to use that number. Or dial the office straight when switchboard is open. For counseling and emotional support, persons may dial 664-7269 and 665-9565. Persons are reminded to use these numbers as no face-to-face counseling is presently being done at the counseling center. To our new clients, because we are getting quite a bit of these, again, no face-to-face interviews and intakes are being done at the main offices of social services. That would be the one on Park Range and the one across from Honkins on Government Road. You will be asked when you come to the department to leave your number. If you are visiting for a situation, we will take your information so that your matter can be dealt with, and someone will return you a call. Persons benefiting from the Poverty Alleviation Program, more commonly known as the $500 program, are asked to note that April checks are available earlier this month. From today, April 20th, these are being distributed from the department for those who would normally get the check in hand. For those whose accounts are being credited, please visit your bank and access your money in the normal way. As a reminder, new clients wanting to sign up for PAP can do so at www.stats.gov.kn. The arrangement for collection of food vouchers for April remains the same as of today. These can be collected from the department at the end of the month. And these would be for persons on long-term assistance from the department. With regards to applications for COVID-19 assistance, as of 17th April, 174 calls have been received. A substantial number of these requests have been processed, and we continue to work to service individuals, and the officers are returning calls and verifying information so that we can provide our best service. And what is our best service? That is issuing the assistance to persons who need it the most. We do understand that everyone who calls is to be respected in terms of their request, but we are servicing the most vulnerable people first. And I think sometimes people, they don't want to accept that, but that is the way we do our business at social services. For persons who are having trouble accessing the Social Security assistance forms to apply for that assistance in response to COVID-19, or who did not understand the process, we have been giving information and providing the forms to assist with that. So if you fall in that category, we can assist you at the department with the procedure, not with the assistance, but with the procedure. As of 17th April, as regards the elderly, 65 persons have been assisted with verification letters to move around to care for seniors, and 47 calls have been received to inquire about registration for PAP assistance, especially in light of COVID. Again, that website, www.stats.gov.kn. Except for full lockdown days, our social services offices are considered an essential service, and we continue to open. Clients who must can access the main office on Park Range, but are expected to follow posted safety guidelines when they come in for business. Thank you.
Thank you, Ms. Maynard, for those updates and for providing the contact information and the status in regards to the Poverty Alleviation Program and the website persons can log on to. We now invite Ms. Curtis Clark, who is the psychosocial focal point for the St. Kitts Nevis Red Cross Nevis branch, to make a presentation. Ms. Clark.
Thank you, Mrs. Carty-Keynes, and greetings to all. I am Curtis Clark, psychosocial support focal point representing the St. Kitts and the Nevis Red Cross Society, specifically the Nevis branch. I stand before you to update the general public on the National Society's initial response in our fight against COVID-19. We are aware of the physiological, social, and psychological impacts of COVID-19. Thus, from a series of discussions relating to possible relief efforts, the National Society has launched the Psychosocial Support Hotline services. Psychosocial support is the provision of basic assistance to persons in instances where specialized services, such as counseling, may not be required. Some instances where psychosocial support may be needed are fear of falling ill, fear of loss of livelihood, that is, not being able to work, facing boredom and loneliness, and the urge to simply talk to someone. Other cases that require specialized services, for example, reports of abuse, will be referred to the relevant agencies and departments. Since this initiative is facilitated by the use of mobile phones only, I take this opportunity to share with you the names of the trained PSS providers, mobile numbers, and available times, all relating to the Nevis context. Curtis Clark, available daily from 9 a.m. to 4 p.m. and can be reached by calling 663-7879. Lornette Swanston Morton, available daily from 2 p.m. to 6 p.m. and can be reached by calling 664-4119. And Nurse Joya Walters, available daily from 7 p.m. to 10 p.m. and can be reached by calling 665-4583. Please note that the PSS personnel are mandated to comply with the following codes of operation: confidentiality, presenting of facts, following up, maintenance of call log, referrals of cases where necessary, and avoidance of false hope. As we are mindful about the mental and emotional states of our frontline workers, I am presenting to the Ministry of Health 4 feeling charts, and this is in effort of cataloging and monitoring the feelings of our essential service providers. Certainly, we care about our frontline workers and their well-being. As we seek to complement the efforts of the Ministry of Health and the Ministry of Social Development, we encourage our citizens to take advantage of this service in effort of preserving your psychosocial wellness. The Red Cross Society is also currently engaged in further discussions that are aimed at providing relief in tangible ways. We will update at the appropriate time. I use this opportunity to thank Flo for facilitating this hotline service, and to Dr. Amri Mori, PAHO's consultant psychiatrist, for extending the training to all of our volunteers. Remember, COVID-19 does not discriminate. Therefore, let us continue to comply with the precautions of the medical officer and her team. Let us continue to support each other. Remember, we are in this together. Thank you, and may you remain in perfect peace.
Thank you, Curtis Clark, for making that presentation on behalf of the Red Cross, I think it's Nevis Red Cross, Nevis branch. And we're happy for the additional support along with what's provided through the Social Services Department. And mental health is a very important aspect. And so we encourage persons to reach out to the Red Cross if you need that support, and also to the Social Services Department. I now invite Mr. Huey Sargent, who is the Permanent Secretary in the Ministry of Agriculture and Task Force member, to make his presentation.
Good afternoon, everyone. I want to urge our farmers and fishers to continue to be guided by the guidelines in our latest round of curfew regulations. I want to advise the general public as well that seeds continue to be distributed for backyard farmers at the marketing division. They're open from 9 to 11, Monday, Tuesday, Thursday, and Friday, as long as stocks last. Same thing for fertilizer. These items are being distributed at Prospect and goes from 9 to 11 a.m. on the relaxed curfew days. Our abattoir as well continue to be opened for persons trying to access local and fresh meats from 8 to 1 p.m. daily. And we are also processing meat on a limited basis. So farmers will be contacted when their turn comes. Our agro-processing unit as well will be opened on a limited basis, going from 8 to 1 p.m. This week, Thursday and Friday, we'll be producing bread, pumpkin bread, and cassava bread. So I know persons who have been calling and requesting. We'll do our best to ensure that you get your pumpkin and cassava bread. Our plant propagation unit are open for persons who are still interested in accessing fruit trees. Our fishers are asked to continue to adhere to the regulations, and in terms of when they bring their catch should be sold wholesale. We're not encouraging you to go on the road and trying to sell fish and interacting with many persons. We have made the fisheries complex available for persons or fishers bringing in their catch. And finally, an appeal to our vendors. We continue to receive calls about price gouging. It's not something that we want to see, but if it continues, we'll have to take remedial action. So please, try and sell our local fruits and vegetables at a reasonable price so that as many persons as possible can access. Thank you very much.
Thank you, Mr. Sergeant, for your update and for the instructions given in regards to price gouging and also the availability of fresh bread shortly. So we look forward to that. And now ask Ms. Zanella Claxton, who is the Principal Education Officer, Department of Education, and Task Force member, to give her update.
I take this opportunity first and foremost to say thank you to all of the members of our team who have been working assiduously and diligently to ensure that we get through this transition process as we look towards transitioning to remote learning. School started remotely today, even though the school facilities are closed, and our students have, of course, their packets which were given prior to the closure. The packets would have had enough information to keep them engaged for up to 2 weeks or more. Some students started on our advice based on the fact that so many students were at home and didn't have much to do. Some started the packets, but they're not complete. So we're encouraging those students, the parents, to ensure that the children finish these packets starting today. So you should ensure that the schedules that your schools provided are followed and that the work that is on the packet is done. This is, of course, a differentiated approach to remote learning. So we are not going directly into the virtual space, but this is also remote learning. People are confusing remote learning and virtual learning. Remote learning is learning outside of the school space, and so students have that opportunity, and they have that, and that is, of course, an equitable response. Flow study credentials have been sent to the schools with the instructions for parents and an embedded video. So parents, schools will distribute. Please be patient. They received the codes late, and so please be patient with your principals as they get that information out to you. Round one, or the first round of the training for teachers, will commence tomorrow the 21st of April. And so teachers will be trained on Microsoft Teams, and that will be done starting tomorrow. Virtual classes, the virtual learning spaces will be up and running for May 4th. For our students who are doing CXC examinations, many of the teachers continued to have sessions remotely during the vacation period. One of the concerns coming from the teachers is that this was something that was started prior to closure, and lessons would have happened whether or not we had a closure, but the students are not showing up. They're not logging in, they're not signing in. And we know that we cannot come into households and control what's happening at the household level, but we're asking for parents who have students in those CXC classes to check with them and to, of course, reach out to their teachers, and we are going to do the same, to make sure that these students are submitting their work, are keeping up with the last few lessons that need to be done. In reality, at this point, we would have had about 1 week before the official closure for CXC students. And so teachers would have been doing the work. They took out the entire few weeks of closure to instruct via various means. The students, on the other hand, have not been consistent in attending. Additionally, due to the fact that a large portion of the CXC results is hinged on the SBAs and IAs, the teachers have given students an opportunity to improve on their grades, and some students are still yet to submit something that is concrete that will make sure that they pass. The teachers are once again giving of themselves, giving of their time, ensuring that in the midst of all of that is going on, that the students have the opportunity. So parents, we will be contacting you on an individual basis, but we're asking you to be vigilant with your CXC students in particular at this point. Remember, there will be no paper 2, and so they have to use these grades. These grades are important because they will determine whether they pass or fail. And we do not want it to be said that because we did not have procedures in place and mechanisms in place, the students were unable to pass. So please make sure that they're submitting their assignments. And I'm sending this appeal out on behalf of all of our teachers who are working diligently to make sure that they serve our students. If you have any questions or concerns, please channel them to your relevant schools, and we will try our best to respond in a timely manner. So reach out to your principals, and we will respond from the department. They'll reach out to us in a timely manner. Check the Facebook page, Ministry of Education Nevis, and www.education.gov.kn for updates. Together, we will continue to cater to the holistic development of our students. We cannot do it without you. Please stay safe and be blessed. Thank you.
Thank you, Ms. Claxton, for that update from the Department of Education. And we're happy that the Ministry of Education, both St. Kitts and Nevis, is providing various avenues for learning to take place. We've now come to the end of all of our presentations, and we open up for questions from our media persons. Shamika Budgin of Von Radio, question: can you verify some of the businesses that should be open on Monday, Tuesday, Thursday, and Friday? We are quite aware that the banks, utility companies, bakeries, supermarkets, pharmacies, agriculture department, and some hardware stores will be open to serve the public. Could you confirm if barbers and other salons should be open, as the Attorney General said on Saturday that the barbers can open, but then the Premier said yesterday afternoon that no one should be close to each other? Can someone please clarify this, as some persons are confused? Superintendent David.
Okay, thank you for that question. I will go to the regulation, and I look at Regulation 16, which speaks to exceptions for days of limited operations. When we look at Subregulation 2, Subregulation 3 Sub-regulation 1, where it is not possible for a business to function in accordance with the provisions of regulation 7 relating to social distancing and physical distancing, that business shall cease to operate for the duration of these regulations. So therefore, what I understand from this, if a business cannot provide for social distancing and for the sanitization of the customer's hands, that business should not be operating. The question may be asked about a barber shop. The barber must ensure that him or her and the client or the customer wear a mask. Before that person enters the establishment, he or she must have sanitization to sanitize your hands. And once all those things are done, and there's sufficient spacing for persons to move about, what the regulation is saying that a business can operate.
Thank you, Superintendent. Upon radio, how confident is the COVID-19 task force and the Ministry of Health in allowing citizens and residents to be out in the public for 4 out of the 7 days per week in trying to stop the spread of the virus? Do you think it was wise to introduce such an act so quickly? Dr. Judy Nisbet will answer that question.
Thank you, Shamika, for your question. Now, a number of things were taken into consideration in making this decision. We have to bear in mind that persons have been at home for quite a bit, and that there are some things that persons need to do. For example, hardware stores are now open, and there are other business that people need to do. Now, the World Health Organization has guidance on relaxing measures, the strict measures that we have been enforcing, and we have been following those. The regulations also help us in regulating how persons operate. For instance, the wearing of masks, the sanitizing of hands before entering businesses, how many persons enter a business, and so forth. So it's not a free-for-all. It's a gradual process, and there are measures that are still in place. And also, as I said before, within health, we continue our testing, we continue our isolation, we continue our quarantine, so we have not stopped working within health, while we relax some of the measures for persons so that they can get a little, chance to do some business.
Hello?
Hello.
Good afternoon.
Good afternoon.
Monique Washington, Stinkis Nevis Observer newspaper. I have 2 questions, one for Mr. David and one for Ms. Claxton. I'll start with Ms. Claxton first. I know she spoke about, again, virtual classes and virtual lessons, but my question is, what happens to those persons that do not have access to internet at home or who do not have devices to support the virtual lessons or classes?
Ms. Claxton?
Thank you, Ms. Washington. Prior to the school closure, when we realized that we may have to migrate to virtual spaces, we conducted some surveys, actually 2 rounds of surveys. One round was a teacher survey, and one round was the parent survey. Now, the parent surveys were both virtual, online, and paper-based. So in case, for instance, a parent didn't have internet and circulating online would not have reached them, we ensured that we sent a paper-based copy, and then at the office we keyed in the responses into our database. The teacher survey covered both teachers and students. So the teachers also were asked to investigate and ask their students whether or not they had internet and devices at home. So we had many layers. Of course, it would not be a perfect response, but it would have given us a snapshot as to where the needs are and how we could respond accordingly. With that information, we went ahead and created and had some negotiations with some of our local service providers in Digital and Flow in Nevis, and of course on St. Kitts they negotiated with the cable. And we are able to place internet in those homes that do not have internet for the duration of the closure. Now, of course, post-closure, that internet would not remain unless that individual decides to keep it. But as long as the schools are closed, those students who don't have internet at home and those teachers who don't have internet at home will be catered for. In relation to devices, the same obtains, and so the devices will not be the property of the students in this instance. They are going to be part of our ICT expansion project and curriculum enhancement project, which means we will see more technology being integrated in the schools under the new curriculum, and they will just serve to help to build our stock for that project post-closure.
All right, so for the students who do not have internet and whose internet will be provided, who will be paying for that? Would the parents be paying for that, or will the Ministry of Education or the NIA or federal government be paying for that?
Okay, so the entire process has been a federal response. We've been working with our colleagues in St. Kitts, and as part of the response, the parents will not have to pay for the internet because it is part of the COVID-19 response, and so the expense will be covered under that particular project.
Thank you, Ms. Cox.
You're welcome.
All right, Monique, we'll take your question for Superintendent David.
All right, Mr. David spoke about regulations and businesses that should be open and those that should not. He spoke about bars, but many bars also double as a snacket, so they are bars/snacket. Now, when he speaks about bars not open, does this include the snacket part? And if the snacket is able to open, how can they ensure that liquor isn't being sold at the same time?
I'll allow Mr. David to answer.
Thank you very much, Ms. Washington. I will say to you that if, as a matter of fact, based on the Liquor License Act, Chapter 18.21, these sections should be separated. So if someone does not have them separated, they are to, 1, remove all alcoholic beverages from the refrigerators off the shelves and stock them elsewhere. And 2, you're supposed to remove the permit or the license from visibility, because it says here, I have it here, Regulation 14, suspension of all retail liquor licenses, notwithstanding the provision of the Liquor License Act, Chapter 18.21, all retail liquor licenses are suspended once a period of emergency is declared in relation to COVID-19. So if this act is suspended, that means no one should be displaying anything to say that they are selling. You should have no license on your property to say that you have a permission to sell, because the government has suspended that under COVID-19 regulations. And you should have nothing exposed for sale, or you should not invite anyone to say, oh, they are my guests, but then the truth and in fact you are selling. Once that is found out, persons will be charged, whether you will be arrested, summoned. The monies made will be seized or forfeited, and the other remaining liquor, they also can be seized. That's what the regulation provides us. So we are encouraging persons. For now, you can do without alcohol. For now, yes. If you drink alcohol, you can do without it. And if you want to make money, continue to sell the dry goods and leave the alcohol alone. So I hope that I answer your question.
All right, but who will make sure that the bars/snacket remove the alcohol? Is there a task force or a set of police officers that go around to the bar/snacket to make sure that there is no visible sign of alcohol on their shelves or in their refrigerators?
Very good question, Ms. Washington. I would say the district police officers and the patrols, we are making checks on those. And, you know, we have within the task force, we have a team based on the regulation that is being formed for that. So we will be making our necessary checks to ensure that these are done. So I myself was driving through, and I had reason to stop at a place and tell the person they have to close. And persons who were there, they had to vacate. I did not summons arrest, but I just read the regs to them, and they say, okay, sir, and they move on. So once we have compliance easily, we may not charge you, whether arrest you or summon you, but we'll encourage you, and we hope that you will continue to carry out that instruction and follow the restriction under this regulation we're currently being operated under. So yes, the police, the task force and its enforcement team will be out doing that. The police are already out there, but now we have extra hands, extra boots on the ground, so we can vigorously enforce this section.
Thank you, Mr. David.
Okay, you're welcome. Okay, you're welcome.
Thank you to all the media houses for your questions. Also like to remind persons to please obey the instructions that are given in regards to the state of emergency, to wear your mask, to practice social distancing, to wash your hands often, disinfect surfaces, avoid touching your face with unclean hands, and make sure to stay at home. If you don't have to move about, stay at home. You have the hotline number, which is 311 or 661-5051. Also want to remind persons to sign up for Nevis Health app. It is a way to self-monitor your health during COVID-19. You can log on to kn.unhin.org and sign up. This is one of the measures we have put in place for all of us to fight COVID-19. It's a self-monitoring tool. Report any symptoms that you may experience during COVID-19. Also, the briefings are aired Mondays and Thursdays at 8 p.m. on Nevis television. Also, you can get the briefings on the YouTube channels and Facebook channels, Nevis Television, Nevis HPU, and Nevis NDMD, Nevis Disaster Management Department. Tune in again on Thursday at 8 p.m. on Nevis Television for another update at the EOC briefing here on Nevis. I'm your host, Nadine Carty-Keynes. Thank you for viewing.